Assalamu alaikum warahmatullahi wabarakatuh. To carry on with the embryology lectures, I'm gonna talk today about the development of the duct system in females. I'm Dr. Dalia Saleh, professor and head of anatomy department at Mansoura University. The objectives of my presentation will be about: first, I will cover the indifferent stage in development of the duct system, both the mesonephric ducts and the paramesonephric ducts. And then I will talk about the different stage in development of the duct system in female. So we will try to answer the following questions: which duct predominates in female, and the derivatives of the paramesonephric ducts in the female, and also the derivatives of the mesonephric duct in female. And finally, I will cover the anomalies of the female genital duct system. Starting with the indifferent stage in the development of the duct system. By indifferent stage or indifferent ducts, we mean that at this point, the two duct systems are present, the mesonephric and the paramesonephric ducts are present, and you cannot distinguish this embryo is male or female. So first, let's revise this simple diagram. If we take a cross section in the embryo at this level, you're going to see the following: from posterior to anterior, or from dorsal to ventral. You can see the developing spinal cord and the vertebral column. Ventral to it lies the dorsal aorta, and attached to it or near it at this point, the dorsal mesentery, where the intestine is hanged or supported by it to the posterior abdominal wall. They terminate, of course, or the intestine terminates by the hind gut, which opens into the cloaca. But actually, at this stage, the cloaca already divided by the urorectal septum into posterior anorectal part and anterior urogenital part. So the hind gut now terminates at the anorectal part of the cloaca. Thus, the ventral part of the cloaca is the urogenital sinus. Back to the posterior abdominal wall of the embryo. On each side of the dorsal mesentery, we have the area where the gonads develop. This is the genital ridge. Lateral to it is the part where the urinary system will develop. Together they are called the urogenital ridge. So in this part of the intermediate mesoderm, so you can see in this area the mesonephric ducts, which open on each side of the urogenital sinus, and near its termination emerges the ureteric bud that will stimulate the intermediate mesoderm at this region to form the metanephric cap, and together they will form a definitive kidney. Lateral to the mesonephric duct lies the paramesonephric duct, which will have a triple relation to the mesonephric duct. First on its lateral side, then crosses it ventrally, then gets to its medial side, and eventually opens into the urogenital sinus. For the development of the ducts in the indifferent stage, if we talk again about the duct system, we have a pair of mesonephric ducts. The other name of them is called the Wolffian ducts, and they act as a collecting duct for the mesonephric tubules, or the temporary kidney, which develops in the thoracolumbar region. We also have a pair of paramesonephric ducts. The other name of them is called the Mullerian ducts, and they develop as a longitudinal invagination of the coelomic epithelium. They lie anterolateral to the urogenital ridge. Each paramesonephric duct opens cranially by a funnel-shaped end into the coelomic cavity. Then each duct passes lateral to the mesonephric duct, then crosses it ventrally to get medial to it, and eventually opens in the posterior wall of the urogenital sinus in a projection called Mullerian tubercle. The mesonephric ducts, they are the collecting ducts of the mesonephric tubules. Each lies dorsolateral to the mesonephric tubules and then opens on each side of the Mullerian tubercle at the back of the urogenital sinus. So now with this question, how the female duct system differentiate? Let's revise the anatomy of the female uterus or the female genital tract first. You know that from your study of anatomy that the uterus looks like a pear, but actually this pear is upside down. So the deepest part or the bottom of the pear is called the fundus, now lies superior, and its narrow part, which is called the neck or the cervix, lies inferior. So this is the body and cervix of the uterus, and the body, its topest in here now, is called the fundus of the uterus. From the lateral angle of the uterus, we have anteriorly a ligament that holds the uterus in its position. It's called the round ligament of the uterus. And from this corner, but directed posteriorly, is another ligament which connects the uterus to the ovary. It's called the ovarian ligament. Between these two ligaments lies the uterine tube or the fallopian tube. And we can see part of the broad ligament here, which is a peritoneal covering of the uterus, and the part that holds the ovary to the uterine tube here is called the mesoovarium. So what makes one type of duct system to regress and the other one predominates is the effect of the hormones. Because in the female there is no testis development, so there is no testosterone secretion. That's why the mesonephric duct system will degenerate. Also because of the absence of the testis, there is no Mullerian inhabiting substance. That's why the paramesonephric duct system will develop. And the paramesonephric duct system will develop into fallopian tubes, uterus, cervix, and the upper part of the vagina. Now let's start with the system that will regress. First, the mesonephric tubules. They were functioning for some time in the female as a temporary kidney, but later on with these mesonephric tubules will regress, except small rudimentary parts of it lies in the mesoovarium, part called epoophorone and the other one is called paroophorone. What about the mesonephric duct? Same as male, the mesonephric duct gives structures that share in the formation of the urinary system, so it is fixed both in male and female. It gives rise to the ureteric bud and also share in the formation of the posterior wall of the urinary bladder, which is called the trigone. So we can see this in the female too. So the mesonephric duct in the female will give rise to the ureteric bud and urinary bladder trigone. However, the rest of the mesonephric ducts will degenerate, except for the most caudal end of the mesonephric duct will give something called the Gartner duct found on the lateral wall of the vagina. Sometimes this remnant get enlarged and form Gardner cyst. Now the predominant duct system that will prevail in the female is the paramesonephric ducts. In this sample diagram you can see the hind gut and terminates at this area which is called the cloaca, and this is the allantois. Also we can see the mesonephric kidney, and these are the mesonephric ducts that open into the cloaca. Then with the progress of development you can see that there is a projection coming out of the caudal end of the mesonephric duct. This is the ureteric bud, and the part that covers its upper end like a cap, this is the metanephric cap, and post they will form the definitive kidney. In the same time, you can see a small duct that appears lateral to the mesonephric duct. This is the paramesonephric duct. They will grow like this and have a triple relation with the mesonephric duct, like I said before. First, they lie lateral to them, then cross them ventrally, and then get to their medial side to open into the back of the urogenital sinus. Now you can see that the cloaca has been divided into dorsal anal part and ventral urogenital part. What about the different parts of the paramesonephric duct? Its cranial vertical part opens into the coelomic cavity. Its middle horizontal part crosses the mesonephric duct ventrally, like I said, and their caudal vertical part again fuses with each other in the midline, like this. We have cranial vertical part, middle horizontal part, and again caudal vertical part, and these two caudal parts will fuse with each other in the midline. You can see with further growth, now the mesonephric duct system, either the collecting duct system or the mesonephric tubules now regress, and the definitive kidney now develops. This is the ureter and this is the kidney, and the paramesonephric ducts get more and more enlarged, and they fuse by their caudal vertical parts in the midline till we reach this final form. Now you can see that the anal canal is completely separated from the urinary bladder. In between them lies the female genital tract, and also you can see that the definitive kidney has already been developed. This is the ureter and this is the definitive kidney, and you can also see the regression of the mesonephric duct system and the mesonephric tubules. So the cranial and the middle parts of the paramesonephric ducts will give the uterine tubes, while the caudal parts of the paramesonephric duct that fused in the midline, when they fuse together, they will give us the body of the uterus, the cervix, and the upper third of the vagina. Next, there will be descent of the ovary, but not like the testis to descend outside the body, just move from the upper part of the abdomen till it reaches the pelvis. So the ovaries descend from their original location in the midline of the abdomen to the pelvis. This is caused by many factors like enlargement of the abdominal cavity above the level of the ovaries, also the horizontal displacement of the uterine tubes, and also due to shortening of the gubernacular ligaments. So try to understand this diagram. Again, this is the midline, this is the dorsal mesentery, and this is the intestine. And we said that lateral to the dorsal mesentery lies the gonad. Here in the female will be the ovary. Okay, and lateral to it lies the paramesonephric duct that will develop into the fallopian tubes later on. So the ovary initially lies medial to the fallopian tube or the paramesonephric duct. Then the tubes displace and become horizontally placed, so they drag the ovary down with them, like this. After the descent of the ovary, now the ovary lies posterior to the fallopian tubes. What happens to the gubernacular ligaments? The gubernaculum attached to the lower pool of the ovaries will give rise in this region, will give rise to the ovarian ligament. If you remember the first picture I showed you, From the lateral angle of the or from the corner of the uterus, we have a posterior ligament holding the uterus to the ovary or the ovary to the uterus. This is called the ovarian ligament. The other part of the gubernacular ligament will give rise to the round ligament of the uterus, which is also attached to the corner of the uterus but passes anteriorly through the inguinal canal and attached to the labia majora. So again, this is the corner of the uterus. You have the uterine tube in the middle, and posterior to its origin lies the ovarian ligament, holds the ovary to the uterus, and anterior to the uterine tube we have the round ligament of the uterus, which passes through the inguinal canal to the outside to be attached to the labia majora. Also, the upper pole of the ovary is attached to the posterior abdominal wall to the pelvic wall by the suspensory ligaments, where it can get its nutrition and the vessels pass through this ligament. Now, how the vagina develops? Between the caudal tip of the paramesonephric duct and the urogenital sinus, a new pulp or a new plate is formed. It's called sinovaginal pulp. It grows cranially, so it will push the upper part of the vagina away from the urogenital sinus, and by the 5th month it will become canalized. So the vagina, its upper third, develops like the rest of the female genital tract from the paramesonephric ducts or from the Mullerian ducts, while its lower 2/3 arise from the urogenital sinus or the sinovaginal pulp. The lumen of the vagina, after it become canalized, will be separated from the rest of the urogenital sinus by a thin plate of tissue. It's called the hymen. Now, what about the anomalies of the genital system in the female? We could summarize the anomalies because of the following. Anomalies due to duplication, and this happens or occurs due to lack of fusion between the two paramesonephric ducts. So we can get the following anomalies. Something called uterus didelphys, where it is complete duplication of the genital tract. We have two bodies, two cervix, and two vagina. Or we have something called uterus bicornis. In this part, we have double uterine bodies, double cervix, and single vagina. Or arcuate uterus, where there is some indentation of the lumen of the body of the uterus there. The other cause of anomalies could be due to atresia or lack of canalization or improper canalization of the paramesonephric duct during their development. We could end up with something called bipartite uterus, in which you can see a uterus with indentation at the fundus from outside and also a septum hanging in the middle of its lumen, separating it into two cavities. The other anomaly is called uterus bicornuate unicornis. In this anomaly, if you want to understand it, you have two paramesonephric ducts. This one get canalized, and the other one, just the upper part of it is canalized, while its lower part or its cervix here is not canalized. So we end up with two bodies and a single cervix. This part of the body of the uterus is hanging to the other half by just a fibrous tissue. Or there is complete atresia of one half or one side of the paramesonephric duct, so we end up with just uterus unicornuate, just a body and a cervix and a vagina of just one side of the two paramesonephric ducts. Or the atresia could affect only the part that will form the cervix, so we have cervical atresia. Or the vagina too could have atresia, so we end up with vaginal atresia. This is the end of my presentation. Thanks for listening, and I hope you like it. Please do not forget to subscribe, like, and share.